Hi everyone, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's talk about how to deal with difficult dental patients. And before we jump in, I'd like to remind you about my career hub on teethtalkgirl.com/RDH. If you're ever looking for a specific topic, I have a search bar where you can easily find what you're looking for, and my Instagram @teethtalkgirl. So this video is intended for dental providers, dental professionals. If you are a dental patient and you are worried that you are a difficult patient, maybe because you are anxious or nervous at the dentist, don't worry, you are not difficult, you are fine, and we are on your team. We're rooting for you, and I actually have a video all about how to overcome dental anxiety. If you're interested, I will link that video in the bottom bar below. So like I said, this video is not about nervous patients. It's for patients who are, maybe for the lack of a better word, not friendly, rude, or disrespectful. The focus of this video is how to handle patients with tough attitudes. I myself, as a dental provider, I get super nervous when a patient is unhappy or clearly states they are upset about something, whether it be insurance or something that's not even in my control. I still get stressed out when the patient is mad about something. So here are my tips. Number one, always follow your office protocol. Depending if you're the dentist or the hygienist or the assistant or on the admin team, whatever it is, your office should have some kind of baseline on how to handle things. So first and foremost, always follow that. Number two, now what I do is to try and always practice mindfulness. This word gets thrown out a lot lately, but what I mean is to truly take a step back, to assess and be aware of the situation. As dental providers, we can get burned out really quickly. We work long hours, and sometimes it's easy to forget to be a human and look at the situation. In some offices, you may even feel like you're part of an assembly line. Whatever the case, try to look at the situation from a third-party perspective. How would you want to watch this scenario of angry dental patient versus dental provider go down? There are so many situations, so it's really hard to give a one-size-fits-all answer, but this mindfulness practice is something that has helped me immensely. Number three, another way to look at it, a different angle to put yourself is in the patient's shoes. The golden rule, treat others how you would like to be treated and never judge anyone. Kind of helps sometimes. And like I said, anxious patients are not the focus of this video, but just a quick sidebar about nervous patients. Always remember that something may seem like nothing to you because we do this every day, but some patients are seriously afraid of, say, needles. Dental phobia is a thing. All of us are afraid of something, right? Spiders, clowns, whatever. It's valid. So always just try to make the patient's experience as pleasant as you can. And the reason I even brought this up at all when I said I wasn't going to is because sometimes this can tie into a patient with a perceived bad attitude, because some patients may unknowingly give you bad attitude because they are really scared and or concerned about their health or well-being. Whatever the case, my advice is to always assure them. For example, if they are anxious about the pandemic precautions, tell them about all the guidelines and all the things that your office is following and doing to give them a peace of mind. Tell them about the extra PPE, the air filtration systems, the extra suctions and aerosol limiting procedures. Sometimes a little assurance is the answer. Same goes for kids. Our pedo patients love the show, tell, and do. So if someone is concerned and less than friendly about it, never assume, only assure. They might just want some assurance. Dental anxiety can have multiple root causes, such as childhood trauma, fear of the unknown, nervous about the dental office noises, environment, etc. And for each root cause, there can be different ways to overcome it. Ask the patient if they want you to distract them. You can tell stories about your life the whole time. Or do they want to hear step by step what you're doing in their mouth? You can give a monologue about each scaler you're using and what you're using it for and what the suction and the mirror is doing for you, all those details. Or do they want silence because they want to meditate and be in their own world, maybe listen to music in their ears? Whatever the case, communication is key. Communication and assurance. Now, all dental anxiety and dental phobia aside, back to the focus of this video. If you cannot figure out why the patient is being less than friendly, my best advice is to simply ask. Effective communication is key. Understanding and empathy goes a long way. So if you could try to determine what is bothering them, thus the reason they are giving you attitude, it can really help. Sometimes you'll have a patient who is truly being rude to you. They made it clear that they are not nervous, but they are giving you attitude. This is rare, in my opinion. It's not usually a reoccurring thing or anything. So always try to give this person grace. Being a dental professional includes customer service, right? And also, I know firsthand that sometimes a patient who has a bad attitude is more difficult to deal with than a patient with a really difficult mouth. Sometimes us dental professionals, I get it. Sometimes we prefer a really nice patient with difficult sub-G calculus instead of a super easy, barely any plaque, rude patient. So full circle here. kindness is usually the best answer. Listen carefully to them, remain calm, be nice, try to smile under your mask when you're talking to them. Ask if there's anything you can do to help, even as simple as politely asking if they would like a sip of water before you start. Any kind of act of kindness is very important in these situations. I also asked for tips and tricks from you all, my fellow dental professionals. I asked on Instagram, and here they are. Patience. Remember, the appointment will be done eventually.
Remember, they are only in our chair for 45 minutes or an hour. Never take it personal. You can't please everyone.
Great words of wisdom.
Breathe and smile, then start again.
Try not to show you are annoyed. Kill with kindness. Give them time, be patient, and understand where they are coming from. That's what we just talked about. Think fluffy pandas and go through it. Deep breaths and envisioning something exciting to eat as a treat when you get home. Make them think they are in control by giving them a job like holding the suction or sensor in place. It's a great idea. Don't let it ruin your day. Yes, always keep moving. Try not to dwell. Easier said than done. Empathize, but don't apologize too much. Kill with kindness again. Don't let anyone be disrespectful. If they are being super difficult, last resort is to ask if they want to speak with the dentist practice owner about it. They will dismiss if it comes to it. Yes, having said that, I do believe there are serious situations of disrespect that can happen. If the patient has crossed the line using profanities or abusive language or scaring you, if this is based off of basic human decency, any of the things that should not be happening anywhere, no matter where you are, in the end, they might realize they were wrong. But if a patient is making you feel uncomfortable, my suggestion is to always talk with your dentist or boss about how to handle it. This is a unique situation, and I hope this never happens to you. If you ever feel a patient is crossing the line into your personal space, that's not okay, and it should be handled appropriately. Dismissing a patient due to their bad attitude is generally not something that is common. Hopefully it will never happen during your career, but if it does, just remember to be professional, be the bigger person, but also stand up for yourself. Don't think you need to handle it alone. All that aside, again, you'll probably never have to experience any type of situation like that, but I couldn't make this video without stating that serious note. Just remember, in all other situations, it is always encouraged to be nice. You will get through the appointment, and you might even be surprised if they apologize to you at the end of the appointment. I had that happen before where a patient was off. They just weren't usually like that. And at the end of the appointment, they thanked me for always being so friendly. And then they told me that they were just let go from their job earlier that day, but still wanted to come in, and they're sorry if they were acting weird. I was like, oh goodness, thank you so much for still coming in and getting your teeth cleaned, you know? So I hope this video helped you. And if it didn't, if you already knew all this, I hope it at least helped you feel not alone. We're all in this together, professionals helping professionals and professionals helping patients. For more dental hygiene career information, you can visit my website, teethtalkgirl.com/RDH. Peace, love, and teeth.